Okay, folks, we are going to turn now. My next topic, it's all coronavirus today. I want to turn and talk about, I called this topic Coronavirus Numbers Expose the Mission. And I want to just lay out some numbers for you, not just numbers, but contrasting them, putting them in context. I'm going to start with a headline. USA Today is a, allegedly respectable, periodical. People read USA Today. They had a headline yesterday which said, 10,000 dead of coronavirus in USA, more fatalities than 6 wars combined. Now, even reading the headline, I'm thinking, what 6 wars? But, the wars they list, the War of 1812, the American Revolution, Mexican War, Indian Wars. Okay, I challenge you, how many people in the street could even tell you what the War of 1812 was? My point is they pick 6 obscure wars, total them up to make a splashy headline saying 10,000 dead of coronavirus in the USA, more fatalities than 6 wars combined. Now, people, I will say this over and over. Of course, I don't want any fatalities. Nobody wants anyone to be suffering, to contract coronavirus, to suffer with COVID-19. No one wants anyone to do that. But this crisis is being exaggerated by the media for the purpose, as you were hearing Trevor Loudon a moment ago, as I was talking about in the introduction, for the purpose of keeping America perpetually feeling fearful and therefore submissive. When you're fearful, people say to the government, anything you say, whatever it is you want me to do, just tell me what. So let me give you some real numbers. Contrast that. So they're saying 10,000 dead of coronavirus in America, and that would be, January, February, March. We're into early April. In any given month, 1 month period in America, we lose about 54,000 Americans to heart disease, 50,000 to cancer, 14,000 to asthma. We have influenza just in a given month, somewhere 4,700 or above. So we have more people dying of all those diseases every month than the entire population in coronavirus since it came to America. On a similar note, we have all the numbers from the CDC. Again, don't want the coronavirus to spread. I want hydroxychloroquine to continue to work, and it is working. And I want them to have a vaccine if that's what people want. But understand the flu season. Just this year in the flu season, we've had 39,000 cases of the flu. 39 million. 39 million cases of flu in America is the low estimate. High estimate, 55 million. And the number of deaths, somewhere between 24,000 and 63,000. So every year we have flu season. Everybody knows when it's flu season. I have friends who are either more fearful or they, generally speaking, aren't that healthy. So during flu season, I have friends who will say, I'm going to stay home. I'm not going out. It's flu season. I don't want to get sick. I understand that. It's a liberty question. If you feel that way, you should stay home. In the coronavirus situation, if you are among the vulnerable population that's susceptible, or if you're just particularly fearful, you should get to stay home. But the left is using numbers that put in context are just, by proportion, very small, but they put them in headlines to scare the daylights out of you. So then you will continue to be submissive to the government. So you have in America, again, you've had so far, and the date of this article, 10,000 dead of coronavirus, was just a few days ago. And yet you have 10,000 dead of coronavirus and somewhere between 24 and 63,000 dead from the flu. Comparing in coronavirus, we're actually up to 12,000 now dead. I go to the CDC website. Every time I mention their numbers on the show, I go to the CDC website, so I have the numbers. Point is, far more flu cases, far more death, far more contraction of flu cases. But we don't in this country shut down everything in this country. But the coronavirus is too great an opportunity as far as left-wingers are concerned in order to stifle and simply crush the American economy. You never see in the context of data like that, 10,000 people dead. Well, how many people in the world have recovered? How many people in the world have recovered, have had coronavirus and come through it and recovered? You have 75,000 in the world and 4,800 recoveries in the U.S. And so these are just, I'm telling you, they raise numbers to alarm people. And actually, something Trevor Loudon said I wanted to expand on and mention to you. Back when Obama was president in his first term, he was really, really trying to push the passage of Obamacare. So what they did to get the American people worked into a lather of frenzy of anger and fear and weakness was to parade individual cases on the stage with people lined up behind the president, they were dressed in doctor's jackets, and I don't think they were all doctors. They're just people, props, and they'd have a family come out who had, either lost a loved one or had a loved one suffer because they couldn't get adequate medical care quickly enough. He used the individual anecdotal narrative to say, look at this terrible case. Look what happened. This case fell through the cracks of the American healthcare system. So therefore, let the federal government take over the healthcare system. This is a tactic the left uses over and over and over. Same thing with that crying nurse in the beginning of the show today. They want, and CBS wants, people like her breaking down in sobs so that all you're thinking is, oh my gosh, we don't have enough masks. We're sending nurses into COVID-19 patient hospital areas with no masks. This is horrible. This is a terrible healthcare system, and President Trump is screwing it up. This is the entire reason they do these things. They don't care if the stories are true. They don't check if the stories are true. If they can get it out there to hurt Trump and hurt America, they're all about that. Next thing on the numbers, we've talked on the show several times recently about the predictions that with respect to coronavirus infection rates, hospitalization rates, death rates. They all come from models. And as I've said over and over, it matters. Models only spit numbers out at the end based on what number somebody put in the beginning. The models are all about the data you put in to start with and the assumptions you weave into the models. So just recently, just yesterday, the CDC director announced that the virus death toll that we've all forced to stay in our homes, lock down the economy, shut down unessential businesses, embolden the police state mindset in some people, all based on models. The CDC, the virus death toll announced by Dr. Robert Redfield, the head of the CDC, virus death toll will be much, much lower than the models. In particular, one model that we have been talking about on the show very often because it was a model that comes from Gates money. But Bill Gates, his institute that he funds, the Institute for Health Metrics and Evaluation, IHME, huge model maker. IHME models drove decisions around this country to shut down everything, including where I live, Dallas County. They also drastically adjusted down their estimates of number of infection rates, hospitalizations, and deaths. People, we are being driven by models, which, as you step back, remember what Trevor Loudon was just saying, models that aid the left in their ability to expand their power over Americans. And that is what we are doing in this country. That is where we are. Another big data point to keep in mind as we continue, as we should, to question how long should America stay locked in their homes. If you ask Ezekiel Emanuel, somewhere between 12 and 18 months, a year or more, we should all stay home. Every business you've ever heard of will shutter and shut down, except vital ones like, pharmaceuticals, drugstores, grocery stores, the food industry will have to survive because we have to eat. Short of that, everything else will shut down this country. As you heard Trevor Loudon say, the military will not be able to get the funding they need from Washington because everything we have in Washington is being funneled to pay the Americans because of the damage inflicted on the economy, because what the government did to the economy. But one other metric to keep in mind, the reason in Dallas, because I've pressed some of my friends who are these are hugely politically active friends. They supported and went along with what we have in Dallas, which is a total shutdown in this county. I mean, you can get stopped for being out and driving if you are, and they can ask you if you're on an essential errand or not. Now, I'm not saying that happens very much because pretty much in Texas, we still have the spirit of liberty, but I'm telling you, this is what this system is they're setting up. But the reason the IHME models drove the decisions to shut down cities around this country and states around this country was because of the fear of a shortage of hospital beds. And that was the answer I got from my political friends when I'd say, how can you support this? You have, we can do social distancing and hand washing and everything. We're, keeping, no, not shaking hands, no hugging, all this. We can do that and still work. But the answer was the fear of increased infection because we're not going to have sufficient hospital beds. That was the argument around the country. So people started doing, you probably saw Candace Owens and others on Twitter were saying, film a hospital. Go yourself to your local hospital. Film a hospital. To make the point that although there are hospitals in this country with massive crowding and massive COVID-19 problems, mostly New York City, Seattle has a problem, New York City has a problem, most of the rest of the nation does not. In fact, hospitals are quieter. I mean, because they, in most places, outlawed elective surgery. So all these people finally going in to get their knee replaced or whatever the elective surgery is had to be put off, told, sorry, you can't come to the hospital. So we have empty hospitals around this country. This whole thing started on Twitter. People started filming because at first just a story was being told that hospitals are really, really empty, and nurses were coming online, putting things on Twitter like, hey, I work at this hospital. We have nothing to do. We don't have any patients. There's nobody here. We have 0 or only 1 or 2 COVID-19 patients, and everything else has been shut down. But here's actually data, not just anecdotal stories and anecdotal pictures, actual data. And this is from the BeckersHospitalReview.com. This is actually an official site that keeps track of hospital data, and hospitals turn in their data to this organization. So the fact that hospitals around this country, with the exception of the hot spots where they do have a problem and we have to be helping them, we have to be getting them adequate supplies and masks and everything else they need and ventilators. And I'm going to tell you folks, by the end of 2020, we're going to have a surplus of ventilators, masks, protective gowns, protective shields they've been building for people who work in banks and grocery stores or other places. We're going to have an abundance because all these precious American countries jumped into gear, leaped into gear, and adjusted their companies to produce what America needed. But I want to get to the hospital data. There's a story out in the actual official BeckersHospitalReview.com. They're talking about finance. It's a page dedicated to financial information about hospitals and how they're doing. 59 hospitals in this country right now, in the midst of this coronavirus crisis, are furloughing workers. Furloughing meaning putting you out on time. You're on timeout. You're sent home because they don't have any customers. We have MUSC Health, an 8-hospital system based in Charleston, South Carolina, said it was going to be temporarily laying off 900 employees. This is one hospital system. MUSC Health, 8-hospital system based in Charleston, South Carolina, temporarily laying off 900 employees or 5% of its workforce to offset the financial hit caused by the COVID temporary layoffs. Don't affect non-clinical, blah, blah, effective April 7th. Non-clinical employees at Peoria, Illinois-based OSF Healthcare will be subject to mandatory time off or will be furloughed. And I could keep reading these, but they have priority given to COVID-19, which is, right. People in a desperate pandemic, you've got to take care of them first. But the fact is, they have, I'll go another one, citing a revenue and patient volume reduction. The Holyoke, Massachusetts-based Valley Health Systems has furloughed 225 employees, or about 11% of its workforce. Odessa in Texas Regional Medical Center has furloughed 60 employees to offset a revenue loss because they don't have patients coming in. You can go on and on and on, all 59, and you can read this on my website, americacanwetalk.org. Read this. I'm getting at the point that we have been in this segment. I'm trying to drive home the point. We have been in this country manipulated into overreacting to a horrible disease. COVID-19 is real. Coronavirus is real. Our reaction is a manipulated reaction, and the numbers begin to expose that for us. The numbers begin to expose that we don't have the hospitalization shortage predicted. We don't have the caseload that we were supposed to have. We don't have the hospitalization rate we're supposed to have. We don't have the death rate we're supposed to have. We have a media dedicated and determined to keeping America in a state of frenzy, panic, and fear, and therefore, just ready to accept whatever the government edict is. And in the middle of all that, our economy has been shut down, is in ruins. Our economy itself is in ruins. We have no legal right at this time for business owners to reopen. So I'm getting at these points at the start of the show. I still one more second, but the point from the start of the show, this problem is real. The virus is real. The reaction is a malicious manipulation. It's a problem in America. The numbers don't justify the reaction. Leftists in America and enemies of America like China are loving seeing America weakened. And I can't urge you strong enough, if you missed the interview from Trevor Loudon, listen to the points he was making. America weakened is destroying the entire Trump mission to build up America again and build up our military and build up our strength. It's being used by the left to try to destroy President Trump so he doesn't get a second term.